Good afternoon. Welcome to the Committee on Health's hearing today. Let's go ahead and get started. So we will go ahead with our first item, and which will be item number 2, AB 1809 by Ms. Aguiar-Curry.
Thank you. Good afternoon, Chairman and committee members. First, I'd like to accept the proposed committee amendments and thank your staff for all the hard work on this bill. It is a sad reality that some nursing homes in the United States, including California, I can't even speak right now. We give antipsychotic drugs to residents with dementia to control their behavior, despite rules against the misuse of such drugs as chemical restraints. These chemical restraints are being prescribed to sedate and subdue residents who often use behavior to communicate their pain, discomfort, or distress. AB 1809 will help stem this practice in California. According to a 2018 report by the Human Rights Watch, this abusive practice has become more widespread. Based on the researchers' visits to more than 100 nursing facilities in 6 states and more than 300 interviews with people living in facilities, their families, staff, long-term care, and disability experts, government officials, and advocates, Human Rights Watch report, they want docile, how nursing homes in the United States over-mediate people with dementia. Estimates that every week in U.S. nursing facilities, more than 179,000 people, mostly those older and living with dementia, are given antipsychotic drugs without an appropriate diagnosis. Facilities administer these drugs in many cases without obtaining informed consent from residents or their families. Antipsychotic drugs were developed to treat psychiatric conditions like schizophrenia. The Food and Drug Administration requires manufacturers to label them with the strongest black box warning about the risks they pose to people with dementia. The FDA has never approved antipsychotic drugs as safe and effective for treatment of dementia symptoms. Studies find that antipsychotic drugs nearly double the risk of death in older people with dementia. When the drugs are administered without informed consent, patients and their families are not making the choices to take such a risk. AB 1809 builds on existing protections for nursing home residents in state law and regulations. It codifies and expands rules to establish a nursing home resident's right to provide or withhold written informed consent pertaining to the use of anti-therapeutic drugs and the right to be free from chemical restraint. It specifies that residents and their representatives must be informed in writing about the content of black box warnings for proposed drugs and whether the drug's proposed use has been approved by the FDA. Requires that the State Department of Public Health to evaluate nursing facility compliance with these provisions during periodic state licensing inspections. I'd like to present my 2 witnesses this afternoon, Anthony Chicotel, staff attorney for the bill's sponsor, and Californians for Nursing Home Reform, and Lydia Gugic. I respectfully ask for your aye vote.
Thank you. Please go ahead when you're ready.
Good afternoon. Good afternoon. Thank you for this opportunity to testify for AB 1809. My name's Tony Chicotel. I'm senior staff attorney for California Advocates for Nursing Home Reform. We're a sponsor of the bill. I was here in 2009 when we tried a bill that was very similar to this one. It received a fair amount of bipartisan support, and we got it to the governor's desk, but he ultimately vetoed it. His veto message, the governor said, essentially, I am not convinced that there's a real problem with this drugging stuff. Let me ask the Department of Public Health to look into it and then report back to me. To some extent, the Department of Public Health did that. They did what was called an antipsychotic drug collaborative, where they went into about 42 nursing homes and took a deep dive into the psychotropic drug usage in those nursing homes, and they found a lot of violations. But that report was kind of lost in an explosion of interest in this topic that happened around 2011 when there were some media reports and some congressional oversight hearings at the federal level about misuse of psychotropic drugs in nursing homes, particularly antipsychotics. And as much as we probably needed it, we didn't really get a lot of government support on the campaign to reduce the use of antipsychotic drugs. What we got was an effort to get voluntary compliance with the rules. It was a collaborative effort using providers and advocates and regulators working together to bring drug usage down. And to some extent, there was some success there. For about 5 years, the drug rates came down, not dramatically, but steadily. And there was, I think, improved dementia care throughout the country. And I think it was something to be proud of. There's a lot of work put into that. But the effort kind of exhausted itself in 2016, 17. Attention started to be focused elsewhere. And then since the pandemic started, we've had a ton of backsliding on the rates. And it looks pretty much like it did 12 years ago when we started this stuff. So we really, at this point, we really need some help from our legislators to go back to where we were in 2009 to bring informed consent back to the forefront of everybody's minds when it comes to using these drugs, and making sure that the very best people to prevent misuse are given the chance to do that, and that's the residents or their loved ones themselves. So please support this bill. Thank you very much.
Thank you very much.